So we're now in the last quarter, which is a very busy time for general practices, and we still have a lot of flu circulating in the community. While we only have a small number of housebound patients at the project surgery, we really wanted to be more proactive in the care we were providing this high-risk group. When I attended my General Practice Improvement Leaders Programme, I learnt about the PDSA cycle, and I wanted to use this tool to help me to improve the care for our housebound patients and really make it more proactive and holistic. We looked at how we were dealing with the patients at the moment. The consultations were quite rushed. So, for example, a patient with an exacerbation of COPD would ring us and we would just go and sort out the chest infection and examine the patient and come back. We wanted to change this and really approach the home visits in a more planned fashion. So we had a look at the frailty scores and the long-term conditions that each of our housebound patients had, and we decided to dedicate at least 45 minutes each per appointment to go and visit them at home. I'm just going on a home visit now. Although initially this seemed like a long time, we were able to have conversations about how patients were feeling about their health, and for many of them, how they were feeling about perhaps approaching the last years of their life. This work has huge benefits for patients, but can also release time for GPs. For example, a lady who passed away sadly just a couple of weeks ago, and I spent 30 minutes on one home visit, but because I had already discussed with her and her family the possibility of end of life, she was able to pass away peacefully in her own home with her family by her side. And in the past, when I've had patients who have reached end of life, because it can be a particularly distressing time, and if plans are not made, sometimes we've been called every day for the 2 or even 3 weeks leading up to the death because of the distress that the family and the patient are in. And not only is that heartbreaking for us to see as clinicians and patients, it does actually take more time as well. Following on from last month's diary, when I talked about our childhood immunisation work, I'm delighted to say that the practice reached 99% for childhood immunisation targets. The CCG were delighted with our results and have invited myself and my practice nurse to go and talk to our cluster of practices to share our learning, and we'll be taking our quality improvement tools knowledge with us to share our wonderful results.